For more than 3 weeks now, the National Association of Resident Doctors in Nigeria has been on an industrial action as they stay away from duty in protest over alleged inability of the government to meet with its demands. Part of what the doctors are asking for is payment of COVID-19 inducement allowances and medical and life insurance for frontline doctors by the government. Since the pandemic began, there have been many months when the doctors have only received 60% of their salaries. Meanwhile, the National Industrial Court has ordered the striking doctors and the government to suspend all forms of hostilities till September 15. But the doctors, NAT's president, Dr. Osikoya, said the association has not received any court order. Although the government said it will implement the no work, no pay policy, the doctors remain adamant. Joining us to discuss this is the Publicity and Social Secretary of the Doctors Association, Dr. Osikoya Oludotun.
Good morning. Thank you very much for having me on the program.
Dr. Oludotun, you're welcome to the studio. Good morning.
Thank you very much.
Okay, good to have you.
Good morning.
All right. It looks like we're not having any solution in sight in spite of all the court orders and the plea by the government and the ministers. What actually is going on? Are you still adamant as to why you can't resume in spite of the government no work, no pay order, Doctor?
Thank you very much. Well, you can recall that in April, we went on strike.
Yes.
And we were able to call it off after having some agreement with the government, which the government failed on their own part because they asked us to go and suspend the strike and everything will be looked. But we realized that after that, it took us more than almost 130 or 30 something days now. Government is yet to answer us. So now they now ask us to go back to work again, signing another MOU for us to come back to work. Do you think we can trust them again? No, because they are not being sincere on their own part. There shows to us that they cannot be trusted. For now, I'm talking to you, our members are still there. They are owing them salaries. We are not asking for new things. We are asking for salaries of our members. They have a lot of things to use that money for. They work for it. Now, we are work for some days, for months, and government is not paying. Now they want to implement no work, no pay. And I can tell you authoritatively they have already started it. Because the circular came out 2-3 days ago, telling all the MCMDs to put down the register so that they will implement no work, no pay. They paid salary yesterday, and they go ahead with their threats, and our members are not paid across board. Now, look at that. Despite the fact that courts tell us we should remain status quo, government still went ahead and do their no work, no pay. How could you expect us to trust this set of people?
On the salaries, Doctor, is this essentially the responsibility only of the federal government? Because I've had the minister, say repeatedly that about 7 out of the 12 points that you demanded have been met, and that is the state governments that seem to have a lot more to do. So when you talk about salaries being owed, are we talking about federal government, or your members are suffering from what the state governments, here and there have not been able to do for your members?
It's for both federal and states. I can tell you we have our members in federal being 3 to 7 months across all geopolitical zones. Likewise in states, 4 months to 19 months. If the minister said they have done, honorable minister said they have done 70%, where is the evidence? If they have done something tangible, we won't be talking like this. If they are paid those salary, we'll be back at work to do our duty. As I'm talking to you now, our members are suffering. I across board, both in federal and in states. In fact, those ones in state is that one alone what's calling emergency for. Because how can a government be owing 19 months? Some states are paying 42% of the salary. At the same time, they are still owing. That's a serious one. And you want people to be working and putting all their best, both in federal and in states.
Well,
they have bills to pay.
Talking about the federal level, Dr. Oludotun, we did speak to the Minister for Health earlier this week, Dr. Osikoya, as you know, and he reacted to the refusal of doctors like yourself to call off the strike, and he also said that that should happen despite all entreaties to do so. Now, please, let's take a listen to him, and then we'll take another view back with you, Dr. Oludotun. Let's take a listen to what he had to say.
I have always said that we can sit and sort all of this out, but going on strike and not providing treatment options to people who are very sick, you just mentioned just now correctly, cholera, the Marburg virus, which we are trying to make sure doesn't enter Nigeria, and particularly the fear of this third wave of COVID-19. Those are things which are so critical that this is the wrong time to be going on strike. But again, as for the demands they have made, we have had several meetings with them. Several of them are in respect of state governments. And the federal government cannot answer for what state governments have done, or are doing, or are said to be doing. And of the others, majority of them are either already being attended to, but they are really within the purview of, if you are talking about money, incomes and wages commission, budget office, they are not directly actually Ministry of Health issues. And we've joined them in making advocacies, and they're trying to get the right solutions to these problems. There are one or two aspects that have to do, in fact, with common, they have common, let's say common errors, if you like. Some of the salaries or wages or allowances that are to be paid are due, for example, from medical residency training. Some of the things that are supposed to be paid come from the fact that names were either not properly submitted, simple things like that, or names were misspelled, or some people received double payment, and they are being sorted out. There are things of administrative issues.
Well, we are still joined by Dr. Osikoya Oludotun, who is the Publicity and Social Secretary of the National Association of Resident Doctors. You heard the Health Minister just there, and I can imagine that didn't make for the easiest of listening. At the very beginning, he said that this is not the right time for doctors to be on strike. Of course, we've got the third wave of COVID-19 to protect the country from, and other threats such as Marburg disease. Did it feel like a slap in the face to hear him say that, despite the fact that it's clear that you and others like you obviously want to continue doing your good work, but you can't do it because of the fact that you haven't been paid? How did it feel to hear the minister say that?
Well, they are showing that they are politicians. They are different from us, that they are doing the normal essential work. He was saying that, okay, let me just give you a scenario. You are being whole salary. You are unable to take care of your own health or your family health. And we have a COVID-19 out there. You don't have, your immunity is down. They will not be eating good food because you don't have money. How can we say doctors don't have money? But we find it in this country because people are being whole salary and they are unable to do a lot of things. Now you are owing me and you want me to go out there to fight the war, fight the COVID-19. And also, 19 of our members died of COVID-19 last year. The death in service insurance are yet to pay to their loved ones as I'm talking to you right now. Now you are now owing me salary. I don't have enough money to even purchase food for my family, to take care of the health of my family, to buy drugs for them. Now you will now expect us to go and face COVID-19. God forbid if anybody died again, nothing will be done in this country because those that have died already, they are yet to collect their death in service insurance claim as I'm talking to you right now. Now, It cut across both in state and in federal. The state worse than federal, but not that there is none in federal. As I'm talking to you, over 230 doctors and University College Hospital to form salary as I'm talking to you. Likewise in private.
Dr. Oludotun, I wonder if you could give us...
And as I'm talking to you right now,
I wonder if you could give us a snapshot into the average doctor's financial situation. Give us an example of a salary, a monthly amount that you should receive, and how long it's been for many of you who haven't gone without work. Talk to us about the bills you have to pay and how you've been able to survive without being paid for so long.
I cannot give you the exact amount, but what I can tell you right now, let's just put yourself in his shoe. For example, you have 230 doctors in usage. I'm just using that as an example. Being owed 3 to 4 months salary, or people in Ilorin being owed 7 months salary. Now, people have been borrowing money. I can tell you, Otochebi, the NAT president have been paying some people's bill from inception of this program, giving some people 10,000 every month, 20,000 every month for them to augment. A lot of centers are paying, they are giving money to their colleagues that are being owed salary, one way or the other. Like we have our house officer that are being owed salary as of today. There are 114 of them. And government is saying that they are just 2% of the total number of house officers. Mind you, that 2%, some of them are married women and men. They have families to take care of. They have aging parents there to take care of. And we are not talking about the salaries alone. All these things we are asking is not about we are asking for new things. It's something that's been their right. I can't be talking about salary. If I work, you have to pay. And another thing that is happening, we are asking that we don't have enough doctors. But if we go to some practice, that only one doctor working from Monday to Saturday, January to February, at the end of the day, they are not being paid your salary. Another bad thing that happened, the majority of them has been casualized. When we say we don't have doctors in this country, there are over thousands of doctors that are turned to casual workers, local doctors in this country, yet you are owing them money. You are owing them their salary. Those people are crying. I can tell you one thing, another thing, bad thing that happened in most of our hospitals, you pay out of your pocket. And some of these doctors, I can remember one that was pregnant, they are planning now for CS. And she's being owed 4 months' salary. There is no way she can get money to pay for them because hospital expect her to pay to the last kobo. So friends now started contributing money for her so that she can have her safe delivery. And we have one that died on the theater table, and she's still being owed salary. Then we have all of these like that. And not that we cannot listen to the masses, but we plead with the Nigerian people to help us tell the government to do the needful. Be sincere for once. What's there with the salary? If there are other things that are out there, they can easily drop billions of naira for them. How much are we asking for that government cannot pay? I still believe we have money in this country. We work for this. It's our right. We are not asking for new things. We are talking of salary, not even allowances. Another thing, we have salary starting from 2014, 2015, 2016. Government paid only 1 month and decided not to pay again. COVID inducement allowance of some of our members, they paid 1 month and they didn't pay others. It's unfair. They actually deserve it. They work for it. Minimum wage allowances that have been approved by the government since last year. Some of our members are yet to even palpate it as I'm talking to you right now. It's not a new thing. It's something that government is, I don't know. If some people are responsible, they should be dealt with. Not at the masses of the doctor, and the masses are there suffering. We would love to go back to our work if government can be sincere with us and do the needful. That's what we are saying. And at the same time, we are using this medium to promise to tell some governors, like Abia State government, Imo State government, Ondo and Ekiti, at the same time, they are owing our members many months of salaries. We can talk to the government. Federal government can compel some governors to do the needful, except they want to collapse the health system of that state. And so that people will move away. We'll be talking of a brain drain. You are not assisting us. Doctor will not travel. When you are not giving common salary, you are not paying, talk less of allowances. People will move to where they'll treat them very well. Where they honor, I know some people go to Saudi Arabia, they've been paid 6 million in a month. We are not even saying you should give us huge money. Pay our normal salary that we worked for. Now they have started no work, no pay yesterday. They didn't pay all our members. We are not deterred. We are expecting our salary to be paid. Thank you.
All right, Dr. Oludotun, I mean, these are moving, touching revelations, that you have shared with us. And I'm sure that you know that a lot of Nigerians do sympathize with your situation, the situation of your members. But then I wonder if you think that this is the only way or the best way to get your points across, given the fact that since COVID started last year, it's been 4 times that you have gone on strike, 3 times this year, and it doesn't look like things are changing. Is this the only way that you can negotiate with government, or is there something else that you think you can do and your members?
Thank you very much. If I can ask you back, sorry for saying that. What do you think the way forward is? We have met with the government agents a couple of times, many times, go to their offices, turning ourselves to beggars instead of us to be at the hospital treating our patients, why some people should be doing their work. Moving from Ministry of Finance to budget to IPPIS to head of service. And sometimes you get to their office, they'll just leave there sitting down there for over 4 to 5 hours and nobody will ask you. We are to them that they should do to me. One ministry to National Assembly and everything so that things can be done. We discover that they are not building any support. And you are now, this time around, they want us to come back and to sign MOU. We are signing several MOUs. We are signing memorandum of action with an addendum this year. Now, a couple of weeks ago, the government signed another MOU with Nigerian Medical Association. We cannot just be signing things without things being put on the table. We have agreed to some things already that you give us timeline, this thing will be done. Every time we sign memorandum of understanding or agreement or terms of settlement, we have always agreed on some things. Unfortunately, government is not doing their own part. Now, this time around, if somebody now sign an MOU and asks us to go back to work, and they will work for another month, at the same time, they will still owing us those money. And if we go on strike again, the masses will say, these doctors are not nice. Why can't we use this opportunity to settle this thing once and for all? This strike we are talking about is going to 4th week right now. And I can tell you, nothing has been done. We are back on this August 2nd. Nothing has been done as I'm talking to you. In fact, the only thing they have done is to take us to court and at the same time do their evil thing by doing no work, no pay. They are easy. It's easier for them to do the negative thing than to do the positive aspect of it. So for the past almost 4 weeks now, nothing has been done. No payment has been paid to any of our members. But we know that they stopped paying. They have started doing no work, no pay yesterday, and at the same time they take us to court.
Another thing that has been happening, that's been happening this week is that some Nigerian doctors have started to make their way or start the journey of leaving the country. Saudi Arabia, for example, had recruitment centers in Abuja, here in Lagos as well. Have any of your members sought to leave the country? Were any of the people that you know in those queues looking for job opportunities in Saudi Arabia? Is that something you are considering at this point?
Let me tell you something. We are not forcing our members to go, but if they want to go, they have the right to go. And let me tell you, you cannot be owing me 3 to 7 months, 4 to 9 months in some state, and I see an opportunity for me to turn my life around. Do you expect me to stay there? We have been begging since this year. These are people, their money. But they are normal money. They have worked for it. And I now see an opportunity that somebody where I'll go and they will take care of me, take care of my family. Do you expect me to stay here where they are making me to suffer? I don't blame them if they are going. I don't blame them. You can't expect one person. I can tell you there's some department that because we have a little brain drain, only one doctor remain in that department. He will be working from morning, 24 hours, Monday to Saturday, Sunday to Sunday, 1 month to another month. And at the end of the day, you are not paying him. It's unfair. At the same time, you now do victimize the person by saying no work, no pay, because he's asking for his right. That's an injustice. How do you expect that person to stay? If you see an opportunity to go, if I'm right here now, I see where they will be paying me regular salary with no interruption, and they are able to take care of me and my family. What do you expect me to stay? I'll go. But we are saying those of us that are patriotic, that are staying in this country, we can still revive this health sector and use this opportunity, the window period of this crisis of that all of us will just come back down again and sign MOU by putting paper and sign, okay, we'll do it. And somebody will just take all those files, put it under his drawer, and go and sleep until we now start going to the office that, okay, we are going on strike again. They will now say, okay, let's meet like 24 hours to when the ultimatum is going to last. Okay, well, what happened? Why don't you do this one and that? I will now do it's a cycle. It's year in, year out. It's wrong. We cannot be going on strike. This time around, Nigerian Association of Resident Doctors, Nigeria in general, we are trying to save the medical profession. Because if you don't do it now, if you decide to come back to work now without having any tangible thing, I can bet it, we'll still go back to strike before the end of December. But they won't do anything.
But Dr. Oludotun, is your association on the same page with the NMA in discussing with the government? Because we have heard from the minister, that some agreements were made with the NMA. You are all doctors, NARD, NMA. But are you on the same page as far as this strike action is concerned? If you can just take that in 2-3 minutes.
Nigerian Nigerian Association of Resident Doctors, we are still a member of Nigerian Medical Association. We have a National Executive Council meeting of yesterday of NME, Nigerian Medical Association at Benin. We currently in Benin. We are on this yesterday, the same page. I believe a communique will soon be released by the Nigerian Medical Association to the government, because they need to look at this situation holistically this time around. Gone in the days of signing and this, we need to settle this problem once and for all, or else there is a danger in the health sector. Because before you know it, already we have 35 doctors working in the country out of 70-something thousand registered. And bulk of it is the Nigerian Association of Resident Doctors, because we are almost 16,000. Now, if you are now treating all these young doctors badly and everybody decide to move out of the country, who will treat the patient on ground? Who will treat the masses? We expect government to encourage us. We are not even asking for anything. Encourage us. Let our salary be regular, so that we have the strength. We'll be able to have money to buy fuel in our car to come back to work, to come and see our patient. But now what they turn us to is for doctors to go to the market and tell Yashin that he's selling rice, please give me some rice. I'll pay you when I collect my salary. Or you go to a filling station, go and sign an agreement with the manager. Okay, at the end of the month, when they pay me my salary, I'll come and pay you. Please give me fuel because I want to go and treat my patient in the hospital. It's wrong. Likewise, people who look at doctor, they'll be calling you friends, families. Dr. So, please now give me some money. I'm broke. I need to eat. I've not eaten for the past 3 days. How will I tell that person that I've not even been paid salary for the past 4, 7, 19 months? It's wrong. We are asking for just salary, not even increment or anything, or make pay.
Sadly, it looks as though we might have lost Dr. Oludotun. Oh, we can still hear him. Dr. Oludotun, we do have just a minute left with you there. If there was something that you could tell the government, I know you've said a lot during these last 30 minutes, but if there's something that you'd like to tell the government, what would that be?
For them to be sincere for once. They should be sincere with all health workers. They can turn around this health industry by being sincere. If those people that are there currently are not doing the needful, they should be put aside and bring out some fresh people that will revive this health sector. Because health is wealth. If all of us are down, COVID is there. If people are down, who will take care of them? If doctors is not hygienic enough, is not having enough strength or energy to do his own work, how is he going to treat the patient?
Understood.
Government should be sincere for once. Thank you very much.
Well, thank you very much for your time there,
Thank
Dr.
you.
Oludotun, who is a representative at the Nigerian Association of Resident Doctors. We do hope for a very swift solution to all of your issues. Thank you for joining us this morning.